Okay, so this is the part of the pharmacology. We are going to talk about the antipyretics. If you give a focus on the name, it's called antipyretics. Antipyretics, something reduce the fever. Pyrexia means fever, increase the body temperature. So if you use something reduce the fever, it's called antipyretics, right? Antipyretics, especially we use for acetaminophen and aspirin. Both of this group medication are also analgesia. Analgesia means pain medication. So antipyretics medication also have a common properties of anti-analgesic. So this group of medication can reduce the pain, can reduce the fever. So acetaminophen or aspirin can reduce your fever, can reduce your pain, right? For the pain or for as an analgesic, we also use the naproxen or NSAID, non-steroidal anti-inflammatory medication. But now we are going to talk about the antipyretics here. So most common antipyretics, you can use acetaminophen. The most popular name of acetaminophen are Tylenol, right? So the acetaminophen, I already told you, but let me recap it again. What are the use of acetaminophen? Acetaminophen basically we use for mild to moderate type of pain or mild to moderate type of fever. Sometimes patient came to you with a arthritis, means joint pain because of the gout or rheumatoid disease. That times the acetaminophen can reduce the inflammation, right? Inflammation. Acetaminophen, what are the NCLEX board asks the question. Keep in mind, we do not give the acetaminophen if patient has a liver problem or liver failure or renal failure. So acetaminophen overdose can cause liver damage, right? If patient has a liver problem or damage, they have jaundice, sometimes very bad itching, right? Or acetaminophen overdose can cause, or side effect of acetaminophen can cause urticaria. If your patient have a overdose of acetaminophen, we have to have something to reduce the activities of overdose, and this is called antidote. So antidote of acetaminophen are acetylcysteine. Acetylcysteine. Overdose sign are acetaminophen overdose sign are patient feel weak or weak pulse with clammy cold skin. So again, I said overdose of acetaminophen are counted by antidote, and antidote are acetylcysteine. Let's go for the another most important medication we should use or we have to know is called aspirin, right? Aspirin we use for the fever, aspirin we use for pain, aspirin we use for heart problem as a blood thinner. So if I told you what are the indication of aspirin, you can tell aspirin we use for anti or antipyretics. Aspirin we can use as a anti-analgesia or analgesia. So aspirin basically drug of choice for mild to moderate type of pain or arthritis because of gout or rheumatoid disease, or also aspirin low dose we use for heart disease as a blood thinner. So aspirin do not give with other anticoagulant like warfarin or heparin or coumadin. It is not, it is good if you do not use aspirin with other anticoagulant like warfarin, heparin or coumadin. And do not give aspirin to the children, or do not give to the children with a flu-like symptom, because if aspirin you give the children, the chance of develop the Rayleigh syndrome. Okay, the pronunciation of Rayleigh syndrome it is here REYE, Rayleigh syndrome. And also stop to taking 1 week before any kind of surgery. So if your patient has to take the aspirin, if they have to go for surgical operation, stop this medication 1 week before any major surgery. Aspirin is a contraindicated for GI bleeding, like gastric ulcer bleeding, duodenal ulcer bleeding. If patient have any history of GIT bleeding, aspirin are the contraindication. So what are the other side effect of aspirin? Okay, so here the aspirin has some of the side effect, like sometimes they can cause severe allergic reaction like rash, itching, difficulty of breathing, or tightness in the chest. Or sometimes aspirin, after taking the aspirin, the black or bloody stool, it means bleeding increase. Or patients sometimes feel confusion or dizziness, drowsiness, or hearing loss. So ototoxicity means hearing loss, or sometimes patient develop the ringing in the ear, okay, or tinglingness in the ear. Especially if the children, if you give the aspirin, don't give it, because patient has to, children has a chance of develop the uh, side effect, and it's called the Rayleigh syndrome. Okay, NCLEX would like this question. And also aspirin can cause the respiratory alkalosis if any toxicity occur. What are the key point we have to know for aspirin or acetaminophen? Nursing intervention, we have to monitor for liver function test, because acetaminophen can cause the liver damage. So we has to monitor the liver function. And never ever give aspirin or acetaminophen with alcohol. The antidote for acetaminophen or tunnel toxicity are called acetylcysteine. Other name of acetylcysteine are mucomyst. So don't forget it. It is super important for NCLEX board for LPN and RN. And also you has to educate your patient, take this two medication with food or just before the food. Take the aspirin with meal and report if any kind of bleeding there, right? Because aspirin increase the bleeding. If you have any bleeding history, do not give the aspirin. Always you has to take with food because food can prevent the GI bleeding. This is more than enough for aspirin and acetaminophen for NCLEX board exam.